Hi everyone, my name is Randy, and I was chosen as one of the leaders this week to discuss the problem solving and decision making scenario provided in this week's module. After reading the scenario, I chose the integrated ethical problem solving module to help guide my decisions. I chose this model because it's used when a difficult situation involves moral or ethical dilemmas and integrates both problem solving and ethical principles to help ensure that the rights and values of the patients are maintained and provides a structured approach to problem solving. This method requires a systemic evaluation of all alternatives, including against ethical frameworks before making a final decision. The first step in the ethical problem or dilemma decision making would be to identify the conflict. In this scenario, it was two ethical duties, the duty to protect the patient's health and the duty for the nurse to protect their career and self-interest. While the nurse has a duty to report the missing cardiac meds required to stabilize her elevated heart rate and blood pressure, the nurse in this scenario is conflicted by the feelings of pressure to avoid disclosing the incident and being reprimanded, which the incident was the deviation from the standard of care. The second step is to gather the facts by identifying key valuables or principles that were involved. First, it should be noted that the nurse charted the medications as given when in fact she didn't know for sure if they were given or not. Also, the patient's vital signs are elevated, such as her blood pressure and heart rate, and this has only recently become apparent, suggesting that their condition could be worsening. Also, the nurse violated a standard of care by leaving the medications unattended, and we should also note that the patient is confused and can't confirm if the meds were taken or not. The third step in this decision-making process is to rank the ethical principles that are most relevant to the issue at hand. The highest priority is the prevention of harm, then the failure to report the potentially missing cardiac meds, which could potentially lead to the patient's worsening vital signs and puts the patient at immediate risk for serious cardiac complications, possibly even leading up to death. This nurse is obligated to also correct the problem and restore the patient's health. Only once the patient is stabilized can the nurse fully turn her attention to resolving the issues of accountability for her actions. This includes the nurse taking accountability for her documentation and then also creating an incident report. Next would be step 4 in the process, which would be to develop an action plan and to make sure that the solution is an ethical decision and it respects the patient's rights and values and adheres to the professional standard of care for nurses. This is when the nurse should commit to a solution that prioritizes the patient's immediate safety. Next, they will implement that plan using the most appropriate actions in regard to this scenario, making sure to communicate clearly with all affected parties. This involves immediately notifying the physician of their clinical change and the uncertainty of if the meds were delivered or not, and then also owning her mistake to the patient and being honest with them. The nurse should also be more truthful in her charting, correct her charting, and file an incident report with truthful facts, and take full accountability for the policy violation. Step 6, which would be the final step, is to reflect on the results of her steps. This nurse must address the immediate and long-term effectiveness of the corrective plan. She could ask herself about what were the clinical outcomes. Did the patient receive the medication? Did the patient's heart rate and blood pressure stabilize after intervention? And then she can focus on if her internal and ethical struggle that she was dealing with was resolved by making the correct choice. She could also acknowledge the professional outcome. Was her probation extended? Was this error placed in her file? And even if those things happened, the nurse should acknowledge that these outcomes are preferable to the alternative of continued or potential harm to this patient. My response to this scenario is driven by the individual variation of values, meaning the core professional nursing values of patient advocacy, accountability, and the truthfulness of the nurse, which are all essential to the nursing code of ethics. My experience as a nurse greatly influences why I think the duty of a nurse to immediately address the needs of the patient and prevent harm is the highest priority in this scenario. As nurses, we all know that covering up a mistake is wrong and should never be considered, even if we fear being reprimanded. In this scenario, after the patient is stabilized, the newly graduated nurse can reframe this incident into a learning experience and learn from her mistakes moving forward. So, my critical thinking question to you is, if you were the unit manager in this scenario, would you prioritize corrective action, focusing on the nurse's failure to properly administer the medication and account for her actions, or would you focus on addressing systemic factors that the nurse cited that led up to the discrepancy in care, such as high patient load, time constraints, and poor team values? Thank you, and I look forward to reading and replying to your responses.